on Mother's Day weekend, you couldn't get near the place.
Okay, I see the live stream is up. So Mr. Chair, I'm going to pass it over to you. And I will note that Warden Hicks will be joining us momentarily.
All right. Thank you, Heather. It is 9:33. We'll call this meeting to order. Just want to welcome everyone to today's long-term Committee of Management meeting. Just remind the elected members of their obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare at that time. We have long-term care report CM08-21, the long-term care operational report to the Committee of Management for the period of February 15th to April 14th, 2021 be received for information. Can I get a mover, please, for that? Moved by Barb and seconded by John. Who is going to lead us with this one? Jennifer?
Great, thank you, Mr. Chair. Yes, I will start us off. So this is the operations report covering the period of time from February 15th to April 14th. And in Renata's absence, I will do my best to give an update on the quality portion. So as you can see from the chart, the indicators are reflecting the increasing resident acuity as well as the impacts from the pandemic. The teams are working with Renata and Dana in each home to focus on these quality indicators and implement strategies to support residents being able to be at their best living during a pandemic and isolation. I also want to just highlight a portion about our strategic planning. So the Color It Mentorship team, which is our words for the senior operating team, Dana, Renata, myself, Joanna. So the group supporting the long-term care homes, the teams in the homes, as well as the leadership teams in each home are participating in 3 Color It sessions led by a leadership coach that we've worked with over the years. And these sessions are allowing us to really dig into our understanding of our Color It vision, which is our person-centered model of care. And it allows us to enhance the experience for our residents, our families, and for our team members. So all 4 groups are participating in these sessions. And at the end of the sessions, we'll bring all the information and all of that learning together and work to create a strategic plan that will lead us well into the future. So I just wanted to highlight that information. Any questions about that portion? And the plan for this report is each of the EDs are going to highlight some areas. We're not going to go through every detail in the report, but if there's something that isn't highlighted that you have a question about, please just at the end, we'll have an opportunity to ask any of those questions.
Is there any questions from committee members before we go on?
Okay, so Shannon, I didn't give much time. Okay, Shannon is going to kick us off for the next portion.
Okay, Shannon, the floor is yours.
Thank you. So under the Ministry of Health Compliance Order and Inspection findings, Rockwood Terrace did not have any inspections for this reporting period. Grey Gables, on the other hand, did have an inspection. The compliance inspector was able to clear the written notifications around falls, and she did do an investigation on the critical incident around abuse, where she had left us with 2 written notifications and plans of corrections. These have been put into place, and we are working with the behavior support team and the physician to manage the behavior of this resident. And if there's any questions in regards to that, I can take those now.
Christine, go ahead.
Thank you, Mr. Chair, and good morning to everyone. Just a very quick question. When the inspector visits the homes, is this virtually or in person?
They actually come in person, and it could be a team, but lately for us, it's just been usually one that has been coming, and they will do a risk assessment as well, usually an IPAC assessment.
And thank you, Mr. Chair, supplementary. Just a question, more of curiosity, if I might, and but it definitely relates to what we're doing here. In terms of the inspectors that visit in person, and certainly pre-COVID, I know that that was occurring through our reports, but it was just a question now based on everything, much of everything we're doing is so virtual. Do the inspectors provide proof of being COVID-free? Are they tested when before they enter? And I guess I'm also expanding that at the appropriate time of whenever there's repairs that are being needed. How do you, as our leadership team, ensure the protection of our residents? Thank you.
Yeah.
I can answer it. So everybody who actually walks through our doors, they go through the whole screening process. As well, they will get tested. When the ministry comes in, they will provide us proof. So they'll show us. So they won't necessarily will get tested at our facility, but they have to provide proof that they have had a negative test within the last couple of days. And so any contractors, anybody that's coming in, they will go through the screening process. They will apply a mask, they will do their hand hygiene, and then they proceed to our rapid testing area, and they'll be tested. They'll wait their 15 minutes, and then once they have their negative, then they can proceed on to fix our equipment or whatever they're doing.
Thank you very much. I appreciate knowing that. And also good morning, Mr. Warden.
Good morning. My apologies.
You had a big day yesterday, Mr. Warden, getting your vaccination. Are you able to raise your arm this morning?
Yes, a slight punch in the arm, and that's about it. It was a beautiful thing. It took 20 minutes, including the 15-minute wait time.
Very good. Okay, Shannon, continue on.
Okay, I'm going to jump ahead now to our outbreaks. So Lee Manor and Rockwood Terrace did not experience any confirmed outbreaks during this reporting period. Grey Gables, however, did experience a GI outbreak on one of our home areas. We had 4 residents and 4 staff members. The staff quickly with the outbreak protocols and with the guidance of public health. After a debrief with the outbreak management team, there was a few recommendations that the home will be working on to improve for the future. Is there any questions around outbreaks?
Any questions? No, I'm not seeing any.
Okay, perfect. I think I will pass it on to Karen now.
Morning,
Good morning,
Karen.
everyone. Good morning. I just wanted to highlight that we have a new medical advisor here at Rockwood Terrace. Dr. Wally has been our medical advisor since the building opened in 1984. So a long time supporter of the home, and we certainly will miss his dedication and time spent here, but he was very much looking forward to retirement. So we're happy for him. Dr. Mary Pillish has taken on that role for us as medical advisor, and that change happened on the 30th of April. So Dr. Pillish has already been in the home for a couple of weeks to do rounds, and we welcome Dr. Pillish to this new role for her. Dr. Pillish has been an attending physician for the home for several years, so she's very much used to our home and the proceedings and policies. But we welcome her to this new role.
Karen, before you go on, can you just give a brief overview of the role and responsibility of the medical advisor, please?
Certainly. So while each resident has their own attending physician, which may or may not be the medical advisor, the medical advisor would oversee things like our influenza campaign, directives for end of life. They attend our professional advisory committee on behalf of the physicians to both bring to us information from that group, but also take back information from the home.
So is there a lot of work between the family physician then and the medical advisor?
I wouldn't say a lot.
No, okay.
A minimal amount. Also, if we have someone that comes to our home, especially from out of area, so they don't have Their doctor is someone that doesn't have a contract with us. The medical advisor tends to be the one that takes them on to become their attending physician while they're here at the home. So a broader overview of happenings of the home than an attending physician would, and takes responsibilities in that regard as well.
Okay, thank you.
Any other questions?
Any other questions from members? Christine, go ahead.
Thank you. I was just wondering, and Mr. Chair, thanks for asking that question. That's great. Does the medical advisor have any role with regard to the ministry inspections?
Typically not. The ministry, certainly we have to keep them updated on who our medical advisor is, and I believe they maybe get CC'd on some information, but when the inspector actually comes to the home, it would be, at least I've not experienced it, it would be very rare that they would ask to speak to the medical director or any of the other physicians as far as that goes. I suppose they could, and they could call them to ask them questions, but that has not been my experience.
Thank you.
I think Stacy's going to take the next session.
Morning, Stacy. The floor is yours.
Good morning. Thank you very much. I get to report on all the wonderful things that are happening in all of our homes, and certainly through the report, you can see that there's a variety of recreation opportunities and special events geared towards enriching the lives of residents that are taking place. Staff have done a remarkable job month after month creating and organizing activities that are fun while still meeting the infection control best practices and cohorting guidelines. Each home celebrated St. Patrick's Day with fun games, special drinks, and a green dress-up day. And the residents always enjoy the silly outfits that staff wear and join in the festivities with some fun attire of their own. And we always like to capture everything on camera around here, so they equally enjoy posing for the snapshots with the staff and other residents on the special occasions, and it really creates that family-like atmosphere in the homes. Easter was just as exciting for residents who enjoyed a delicious Easter meal and a special visit from the Easter Bunny. All three homes also hosted a Tim Hortons drive-through day where residents were treated to a coffee and a donut served from a replicated Tim Hortons drive-through window. Staff put the extra touch on the event by dressing up in uniform and visor to help give residents the full Tim Hortons treatment. And it was a big hit in all the homes. We also experienced a really nice stretch of warm days in March and April that we took full advantage of across the three care communities and supported residents getting outside for walks, relaxing in the garden, and even just outside chatting in the outdoors. And after a long winter, it was really nice to see the residents experience the sights and sounds of spring and just how much it meant to them. Lots of daily activities continue to go on in our care communities, but perhaps the most well-received activity that was reintroduced during this period was the hair care services. Residents really missed that one-on-one interaction with our hairdresser, the pampering and the attention from staff when they go back to the floor with their new cuts and styles, and all the compliments that generates. So to have that service resume was a real bright spot for the residents. So there's lots of great things that continue to happen, and we look forward to taking advantage of new innovative ideas and outdoor activities in the upcoming months.
Thanks, Stacy. I think Mayor Burley's been missing his salon days also.
I think we all have.
Any questions from the committee members? Brian, go ahead.
Thank you, Mr. Chair. I just want to comment on the hairdressing thing. Do we have a hairdresser at all three of our homes? And
Yes.
so they kind of come and go. Are they hard to keep, or what's the track record of having this?
Well, I can speak to Lee Manor. I'm not sure the experience in the other care communities, but certainly at Lee Manor, we've been very fortunate to have ongoing service, and they're very eager to come in and provide the service. And certainly around COVID, there's been some provisions to the services that we provide to make sure that we're meeting public health guidelines and regulations. But certainly from our standpoint here, we haven't had any difficulty maintaining that complimentary service for our residents.
Yeah, I was just curious because I know for any guys that are on this committee, we can all say the same, that on the day that our wives get their toes done, their nails done, or their hair done, those are the days that you can get away with just about anything. And so we know what that means to the women. I think it's important to have it in all our homes. But anyway, thank you.
Thank you.
Any other questions? Stacey, I just wanted to comment, a lot of really unique activities, and you know, the Hawaiian Day, the Island Day, I thought that was really unique, and I think we would all enjoy one of those days right about now. And the 60th anniversary that you were able to virtual party that you were able to have, that kind of stood out for me. So, you know, congratulations to all the homes on the various activities that you're doing to make the stay a little bit nicer for everyone.
Thank you.
Okay, who's next? Is there anything else in this report, Jennifer?
I think I'm going to go.
Okay, Stacey.
Or Shannon with the stakeholders.
Sorry, Shannon.
No, that's okay. Thank you very much. So just during this report, Grey Gables had a public health inspector on site to perform a routine inspection of our food premise. And Grey Gables was cited with 2 repeat observations. Both violations are being taken seriously, and staff have been educated on both issues. Public health has received and approved our action plan for this correction. Lee Manor and Rockwood Terrace also had a public health inspection during this report, but they had no violations noted. Rockwood Terrace had a Ministry of Labor inspection that resulted in 2 orders being issued around mask use and eye protection, but both were corrected immediately. Is there any questions in regards to our stakeholders?
Any questions? Shannon, I did see in the report around the ice bucket being stored in the ice machine.
Yes.
That's a no-no?
That's the no-no, yes. That's it's the scoop that they're using to dish out for the ice. Some have a habit of just leaving the scoop right in the ice machine, and their hand is touching that handle. So it have the contact with the ice. So they have to leave the scoop outside of the actual machine.
Okay, thank you.
Yeah.
Any other questions from committee members? Seeing nothing, Shannon.
Okay, I am going to move on just to our Color It story for Grey Gables. We've had many moments to be proud of during this reporting period, but I would like to highlight our vaccine clinics. Our staff quickly responded to the task of organizing, planning, and gathering the resources necessary to deliver a successful, seamless vaccine clinic. The residents, staff, and DCPs were grateful and complimentary of the processes that we had in place to support an efficient and safe experience. I was very impressed with the leadership team and the staff. They willingly jumped into the action and offered to support the clinics, whether it was registered nurses to administer the vaccine, staff to direct and screen incoming staff and visitors, or to organize the paper trail of records. Everyone was up to the task. Vaccinations were a real milestone in our road to recovery and ignited hope for everyone involved. There was a total of 439 vaccines administered during the 4 clinics. We couldn't have done this without the support of community partners and public health and our dedicated Grey Gables staff. This experience was a great reminder of the power of teamwork, and this will be a moment in our careers that we will never forget. I'm just gonna.
Congratulations, that's great to see the numbers.
Thank you.
Any questions on that report from committee members? Shannon, when you talked about these vaccinations of staff, I think it was 73% overall of our staff that have been done. I'm just wondering, is the leadership team content with that number? Are you hoping to see it go up?
For me and my home, we would really like to see it go up. We are sitting at 82% right now for Grey Gables, but we're continuing to talk to staff and to try to encourage them to get their vaccine.
Okay, thank you.
I think
Jennifer, go ahead.
Oops, sorry.
Yeah, sorry, through you, Mr. Chair. And we'll talk a little bit about vaccinations in the COVID update as well. the vaccination percentage rates in the homes are linked directly to the relaxation of some of the restrictions in the most recently released directives, which hadn't arrived in time at the writing of the COVID update. But I do have a bit of a verbal update to give. So it is really important that we continue our efforts to get as many people comfortable with being vaccinated as possible.
Okay, thank you.
I think, Stacy, we have two more color stories, and then this report is done.
Okay. We'll
If that's
go to
okay.
Stacy.
Okay, thank you. So as described in our activity highlights, the Tim Hortons drive-through was a real success in our homes. And when the event was planned, we weren't expecting the treats and things to be donated when we went to pick them up. But when we went to get our order, we were surprised with a very kind gesture from Tim Hortons that very kindly donated these items to our home. And residents were very appreciative and touched by the kindness. And in return, they really wanted to do something to extend a special note of thanks to all the Tim Hortons staff. So with the support of our staff, they organized a very large customized thank you card with photos that captured the residents' excitement and enjoyment of the treats from the day. And they added some really nice personalized messages directly to the Tim Hortons staff. So one of our staff members went to go deliver it on the residents' behalf, and she was met with absolute delight, excitement, and absolute surprise from this gesture that was really customized for them. And later we received a phone call from the owner as well, who wanted us to know just how much that gesture meant to her staff. And she described how it was completely unexpected and just how much it spread joy and pride throughout her team. And the photos and words helped them see how they impacted our residents in such a positive way. So she shared just how much it gave them an enormous boost in their own morale when they really needed it most. So it was just a remarkable story and a true reminder that when we color it with kindness and gratitude through these difficult times, that we can really help each other get through this together. So it was a really powerful on both sides of that event, and just wanted to share that with the committee.
Thank you, Stacy. Kim, maybe to you or to the warden, is there any form of appreciation letter or certificate that we could send to, the McGilverys, the owners of the Tim Hortons, or any individuals that go above and beyond to provide support for our homes?
Thanks so much, Mr. Chair. I've actually thought that, when things settled, there are a number of people who have done so much throughout this whole year and a half. And whether or not, as a county, we could do something to formally recognize a lot of these people that have volunteered and donated and things like that. Whether it's strictly for long-term care or more broadly than that, I think we could have a discussion. My intent was to kind of talk to all of the different departments and kind of get a sense of how big the cohort was. But I really think it's important, So
Well, yeah.
leave it with me, and
okay, we'll leave it with you.
Yeah, thank you.
As long as we don't lose sight of it, and I
Exactly.
know you won't. So thank you.
Thanks.
And I think Karen
Jennifer?
is thanks.
Thank you. As Mr. Mackey already said, I just wanted to highlight the 60th anniversary event that we had here earlier this year. We can't always do exactly what family requests, like they would have liked to get together and had cake and champagne, but can't go quite that far, but did the best we could and had the designated care partners inside with the happy couple. We decorated the area a bit for them. Of course, family and friends had sent flowers, so that helped with the decorating. And the rest of the family were able to come and go outside for the window visits to take part in the day. It was a very emotional time, not only for the couple, but for any of us who stopped in to wish them well as well. And even though they couldn't have the cake and the champagne together. They were appreciative of anything we could do to recognize this event. So it was a success in the end. And just further to your comment about thanking folks, we do always send a color it card to anybody who does any sort of kind gesture. So they are recognized at the time, but I do think a greater county thank you would be amazing. We don't talk about this as much anymore as we did last year, but people continue at least weekly to do something special for the staff and residents of the home. It is overwhelming. It was overwhelming last year, and I just wanted to let you all know that it continues. It hasn't stopped.
Thank you, Karen. Our staff certainly deserve it. Okay, is there any other questions on this report before we call the question? Seeing nothing, all in favor? That is carried. We now have the report LTCR-CM 0921 regarding the long-term care COVID-19 status update be received for information. Mover to get that on the floor. Moved by Brian and seconded by Dwight. Jennifer, are you taking us through this?
I am. Thank you, Mr. Chair. So there's a lot of things that happened in the 2 months, or I don't know, is it 2 months? Maybe time goes by. So I'll just try to highlight and not go through every single item. There has been several updates and revisions to the directives for pandemic response. March 15th was a set of updated directives, and this had to do with rapid testing frequency. And we opted to continue with, we really wanted to follow the science and the evidence. And so we continue to test 2 to 3 times per week, and we didn't ever make changes to that frequency. So there's been a few times where the directives adjusted the timing to be less frequent and then more, and never more than 2 to 3 times a week. We just kept it at the 2 to 3, and that did ease some of the confusion, I think, as directives change. On April 7th, there was another set of directive updates, and this reflected a change in the outbreak definition. And so this changed from prior to April 7th, an outbreak was any one positive COVID case of a resident or a staff member. And the updated definition is now 2 or more lab confirmed cases with evidence of transmission in the home. And so that does help reduce the number of suspect outbreaks and putting strategies into place while we wait for, to see if it's spread or if there's containment. So that has helped a little bit. April 23rd, there was another set of directive updates, and this allows fully immunized staff to work in more than one long-term care setting, or more than one healthcare setting. So at the beginning of the pandemic, staff were limited to choose one location, and many staff chose to remain at Grey County Long-Term Care as their work site, but some staff did choose another work site. We have reached out to those staff to see if they're able to return to their shifts with Grey County Long-Term Care, but this directive is dependent on fully vaccinated. So they need to have had their second vaccine shot and 14 days past that second shot. And with the supply challenges, the people that we've reached out to have not yet had their second vaccine. Now, there was an update yesterday, I think, that says that timing is being shortened again for healthcare workers. So that should help relieve some of that pressure. Surveillance testing changed with the types of options for collecting the specimen. So here's where I do my best nurse impression. So we were doing nasopharyngeal, so that's the far back. And now we're able to do nasopharyngeal, deep nasal, nares, or shallow. And in fact, the PanBio tests that we can receive now are not nasopharyngeal. So they're the less invasive testing. And that really did help support people's comfort level in being tested 2 or 3 times a week. And on average, the homes are collecting over 1,400 rapid tests every week to support staff testing, designated care partner testing, contractors, et cetera. So it's a big initiative. IPAC strategies were mentioned in the previous report. So some additional IPAC was eye protection was fully implemented on March 12th as a result of Ministry of Labor recommendation. And so staff, DCPs, and any visitors are required to wear this additional piece of PPE. Vaccination, we've talked about that briefly. I do want to highlight the Designated Care Partner Program again. We've talked about it a few times. So the Color at Connect program continues to really support all of the different virtual window visit options. Indoor and outdoor visiting stations are closed during the provincial lockdown, so there's no general visiting happening right now. The DCP program currently has over 350 active designated care partners regularly coming in and supporting residents across the 3 care communities. And Grey County Long-Term Care was invited to present our designated care partner program at a national huddle on March 25th, Essential Together huddle. And it's a program connecting peers for learning and support. And it was coordinated by Healthcare Excellence Canada. And so we were really honored to be able to share our journey and how we've really worked to support essential caregivers. Our program was also featured at the Advantage Ontario Annual Convention last week. And we partnered with the Ontario Caregiver Organization and the Centers for Learning, Research and Innovation, CLRI, to present Partners in Care, supporting safe and meaningful caregiver presence during COVID-19 and beyond. Grey County also partnered with our staffing partners. So Plan A is our staffing agency that we work with, and StaffStat is our electronic call out system to support filling shifts. And we presented a 45-minute pre-recorded discussion of how we handled staffing shortages, field notes from the County of Grey. So it was an honor to be able to support how we've approached some of the challenges during the pandemic. Regarding staffing, we continue to recruit staff every day. We did have some very exciting news. On March 23rd, we received notification from the Ministry of Labor, Training and Skills Development that the Essential Skills Supportive Care Micro Certificate Program was approved for funding. So this is a local Made in Grey Bruce partnership with the YMCA, Georgian College, and Grey County in collaboration with the 19 Grey and Bruce long-term care homes. This is a fully funded educational opportunity, and we've introduced this program to our incumbent team members. So the staff that we hired as emergency support workers or care support assistants are eligible to complete this micro-credential program that really gives a foundation of skills and training for people that put their hand up and said, we're going to help in a pandemic, and we've maybe never worked in long-term care or the health system. So they very bravely came in and we provided training on site. And this just gives them more of a foundation of formal education. And it also, the micro-credentials also provide some credits if they opt to pursue their PSW certificate. So it really helps to forge a path for a career in long-term care. And it can support the path to PSW, RPN, RN. It can support a path to food service worker, to recreation. Really, it gives people an idea of what they need to try working in the health system, particularly in long-term care. And the goal is to build that pool of trained people interested in working and having a career in long-term care. And it's fully funded. And so we're very grateful for the province and our partnerships. And the last I heard, there were already 15 people enrolled in the first cohort and another 12 enrolled in the second cohort. So it's really, really great news. And I'm going to take a breath and pass this over to Joanna, who's going to give an update. There was lots of funding announcements and information over the last few weeks regarding funding.
Thank you very much.
Go ahead, Joanna.
Okay, thank you, Chair Mackey. So there were lots of announcements. So in March, the province extended the PSW temporary wage enhancement program that was originally approved for the period from, I believe it was October 1st to March 31st, 2021. They've now extended it for another 3 months until June 30th, 2021. The province has also suspended co-payment accommodation rate changes to June 30th, 2021. And they've agreed to compensate long-term care homes for the lost revenue. So right now, as it stands, rate increases are scheduled to resume on July 1st, 2021. In April, the province announced the dedicated funding for the testing adherence program would end, but would become an allowable expense under the prevention and containment funding that we receive. The province advised that our 5 temporary beds from our emergency licenses that were issued in March 2020, which gave Rockwood Terrace and Great Gables 2 beds each and Lee Manor 1 bed each, those licenses have now expired and they would not be reissued. We also learned that we were approved for a federal and provincial grant for the replacement of some air conditioning components at Lee Manor through the Investing in Canada Infrastructure Program, or ISIP, the long-term care stream, for a total of $650,000. So more information will follow once we have received and reviewed the transfer payment agreement. And the ministry has issued a directive waiving the co-payment for patients in alternative level of care beds in hospitals. So alternative level of care means a patient who's in a hospital who cannot go home and is waiting for discharge to a long-term care facility. So according to a letter that the Office of the Associate Deputy Minister sent us in April, there are 1,912 ALC patients still in hospitals waiting for admission. The ministry will waive the co-payment of ALC's patients who agree to move to a long-term care facility that is not their preferred home. This waiver will apply until they either transfer to a home of their choosing or decline an offer to move to their preferred home. And the homes will be reimbursed for this lost revenue. And so since we finalized this report, there was one more announcement just to advise the committee. So the ministry has advised that they will be flowing us more prevention and containment funding for the period April to June. In total, for the 3 homes, we're going to be receiving $681,000 for the 3-month period from April to June of 2020. And I'm happy to take any questions.
Thanks, Joanna. That was a lot of information. Just before we take questions from the committee, I just wanted to extend our sincere appreciation to the leadership team for the Designated Care Partner Program. The recognition that received from the Healthcare Center of Excellence and the ambassadorship, Jennifer, that you're providing in regards to that program, it's really a testament to all the good work that's been done by the staff in long-term care. So it's a program certainly to be proud of, and I'm glad to see that other seniors throughout the country are going to benefit from the work that was done here in Grey County. So thanks very much. Are there questions from committee? Sorry, Jennifer?
Sorry, thank you, Mr. Chair. I just will give a quick update of what came in on May 4th. And because it'll be a little bit of time before we meet again. And this is a fairly significant change. So these are updated directives that address 4 sections. So COVID-19 immunizations, required IPAC practices, required operational policies, and required procedures for case and outbreak management. I almost cried when I opened the document because there was a link and it had something like 14 chapters of other links of updates. So it's a really, a lot of it though is information that we already had compiled into one space where we can, long-term care operators can more easily access it. The biggest changes though are around relaxing and modifications to some of the restrictions for fully vaccinated residents living in long-term care. And as I mentioned, many of the relaxations of these restrictions, so for example, more communal dining, closer contacts, more small group activities, from home area to home area versus keeping people cohorted and still distanced. They depend on vaccination rates within the long-term care homes, and they provide a formula to help support. If you have 70% rate, these are the restrictions you can modify. If you have an 80% rate, these are the restrictions that you can modify. So there is a lot of pressure to support vaccine confidence and vaccine uptake. So supply issue aside, once we have supply, hopefully that makes it a little bit easier to hit that fully vaccinated criteria. Then the pressure is the residents' experience depends on our vaccine percentage rate. And so we really need to support staff in feeling comfortable and educated to make their decision about whether they have their vaccination or not. The other significant changes that happened over the weekend were the screening requirement for visitors, so DCPs and staff, is only required on the way in. It is no longer required on the way out. So that does ease some of the pressure at end of shift and some of the bottlenecking and keeping people behind. So we were able to eliminate screening out, and we increased we adjusted our language for window visits to align with the provincial guidelines for gatherings outside. So we had our window visits limited to 2 people, but we changed the language to support window visits for a group of people from the same household or one other person from a single individual household. And that really helped folks to do their window visits over Mother's Day. 2 people was very limiting. So we aligned that language. And many of the modifications are also dependent on the end of the lockdown. So it does give us a bit of time to work our way through this document and be prepared for when the provincial lockdown is lifted. Then we will be able to introduce some of those changes. So there, I just wanted to make sure that you're up to date. And I feel that this is going to be our future for a number of months, is sorting out how we safely relax and modify restrictions over the next number of months. And so there'll be as many updates and changes and directives, I think, for the next 6 to 8 months as there has been for the first 10, 12. And we'll just need to figure out and work our way through that.
All right, thank you, Jennifer. A lot of information, questions from committee members. Warden Hicks, go ahead.
Thank you, Mr. Chair. My question is about for Jennifer really, is there any research, any data about the impact of physical, I suppose, of such frequent COVID testing?
I'm going to look over to my far side of my screen at Dena to see if she knows. I don't know that off the top of my head. What I can say is there was a report released, an opinion released from a science table, and maybe Dena, blink twice if you if you can speak to this, that's related to their recommendation for testing asymptomatic, frequent testing of vaccinated asymptomatic individuals. They don't recommend it. However, that isn't the direction that the province has taken yet. I believe they're taking that into consideration and being very cautious about lifting the restrictions around testing. But as for the impact on the individual, Dena, do you have any comments on that?
Dena, go ahead.
Yeah, through you, Mr. Chair. There has been evidence, but very limited evidence. There's been anecdotal notes about some discomfort. There has been what I understand to be 1 or 2 WSIB claims related to some sort of adverse event following swabbing, but very little. That's why when it comes to a nasopharyngeal swab, having a registered staff who's trained to go with that, and it comes along with a medical directive, which requires that level of training when you are placing the nasopharyngeal beyond that orifice. So definitely what we've done in Grey County is ensured that we, and anyone who is completing the nasopharyngeal has the appropriate training, follows the medical directive, as well as we provide our teams with the option now that we have the nasal swabs as well, which is less invasive. And Jen was alluding to the draft document from PIDAC, which is the Provincial Infectious Disease Advisory Committee, that is recommending once people are fully vaccinated, that we can reduce the requirement of rapid testing. Now, of course, that's the recommendation. The current guidelines are that regardless of vaccination, we'll continue to do rapid swabbing as required. But I think, as Jen alluded to, we are, as we're reopening, we're increasing vaccination status, we'll see some more of those requirements. But it's about doing it appropriately. It's also knowing your client, asking good questions, and supporting them through that process, and offering whichever swab that we now have available to support them. Does that answer your question?
Yes, it does. I just thought, geez, I was tested once, and it's not a pleasant experience. And, to be doing that 2 or 3 times a week, I would think must have some impact. And I'm sure that there's got to be some data about that. In any case, it does answer my question.
Yeah, and I would just add, if you wouldn't mind, that long-term care has been the only sector that this has been a requirement. So our staff have followed through this. It hasn't been required in other facilities throughout this pandemic. So we certainly know that our staff if there have been some issues that may have been noticed in our long-term care staff and DCPs.
Thank you. Mr. Chair, if I might, I have a second question.
Yes, go ahead.
So my second question is about the vaccination rate for staff. And so the report talks about 74% and that it's above the provincial average. But I have to tell you, to me, that seems low. That means, 26% of our staff are reluctant to get the vaccine. We see people lining up for hours, going into the various sources, going on waiting lists, trying to get a vaccine. And we have staff working with elderly people who could be at the front of the line and are reluctant. So that to me is an issue. And I don't know if it's an issue that we ought to be more concerned about. I can tell you, I sit on the board for Children's Aid Society, and just under 100% of their staff were vaccinated quite willingly. And so a totally different culture. I'm very surprised that 26% would not want to get the vaccine. I wonder if we're doing enough. Is there anything more that we can do? And it's not a pointing the finger thing. I'm sure that if we're above the provincial average, then obviously this issue is province wide. But what more could we be doing? It just seems a high number to me that isn't vaccinated.
Certainly a good question and a good point. Who wants to take that one on? Jennifer?
Thank you, through you, Mr. Chair, and thank you, Warden Hicks. And so you're right, it is worrisome, and it is an opportunity for us to find out more about where the reluctance lies. And so one of the trends that we're hearing is concerns for young women, and concerns about their vaccine, the impact of the vaccine that it might have on them. And so unfortunately, lots of information, whether it's factual or not, is accessible through social media, and these things get legs and take off. So we then have an opportunity to bring in experts to give scientific evidence information and answer questions. And what we also know from experts that support vaccine confidence is that that we need to take our time to hear what the worries are and answer questions, and that's the best way to support someone in making an evidence-based decision that they're comfortable with. So one of the things that we're doing is partnering with our partners at South Bruce Grey Hospital Service, and they have an OBGYN who is interested in answering some questions around fertility concerns and answering those kinds of questions. So we need to do some of that nuanced, find out and answer some of those nuanced questions.
Kim, I see your hand up.
I think the data tells us that those that work in the healthcare field, there may be kind of a lag in uptake amongst that group of people. I know that at the end of March, UHN has 4,000 staff and less than half of them had been vaccinated, although they had the opportunity to do so. So we certainly aren't unique in that. Many of these people report that, you know, they've been exposed to the virus, and so from that perspective, I think they feel like they have some level of immunity. It's not the same as being vaccinated, I don't think. I'm not an epidemiologist, but I think there's a lot of factors at play, and I think the research tells us that over a period likely of a couple of years, it will sort itself out. But what do we get, Jen? Is there 20%, 15-20% that would never have a flu shot either? Yeah.
It's actually probably higher than that.
Yeah.
Our average is between 65 and 85%, depending on the year and the population of the workforce.
Okay, thank you. Any other questions from committee members? Seeing nothing, all in favor of the long-term care COVID-19 status update report? That is carried. We now have a report LTCR-CM 1021 regarding the 2021 Infection Prevention and Control IPAC minor capital funding, and new cooling requirements be received, and that the recommended projects contained within report LTCR-CM 1021 be endorsed, and that these recommended projects be funded from the IPAC minor capital funding and minor capital funding for any project deficits be funded from surplus realized from within the respective homes, capital budget, or if the surplus is not available from the long-term care capital renewal and replacement reserves. Can I have a mover for that, please? Moved by Christine and seconded by Dwight. I think, Joanna, you are taking us through this one. Floor is yours.
Yes. Thank you very much, Chair Mackey. Okay, so back in November of 2020, I presented a report about our first or our very first one-time allocation of infection prevention and control, or IPAC minor capital. Today's report discusses our second allocation of IPAC minor capital, which was just recently announced and must be spent by March 31st, 2022. So similar to the first allocation we received last year, the ministry is providing additional support to our homes in making improvements that support IPAC efforts during COVID. However, this year, the ministry has added a condition that if the home does not have air conditioning throughout the home, or if the air conditioning needs updating, upgrading, or repair, that this allocation of IPAC minor capital funding, along with the regular minor capital stream that we receive every year, both those funding streams must target air conditioning upgrades or repairs. So the ministry has also updated air conditioning regulations or cooling requirements that require the home to track and document temperature daily throughout the home and to put plans in place to protect residents from unacceptably high temperatures. So table 1 in the report shows the amount of funding for all 3 homes. I'll just go through each home and how they intend to use the funds, or they're recommending to use the funds. So Grey Gables is recommending using IPAC minor capital funding to replace 2 of its oldest cooling units that provide cooling to the home. There has been an increase in the number of breakdowns and repairs for these units, and they also use an older type of coolant that is being phased out due to the reported harm to the environment. The replacement of these cooling units was scheduled for 2022 in the 10-year capital, but by bringing it forward, this allows us to use IPAC minor capital funding. Grey Gables is also recommending using IPAC minor capital to replace their handrails. I guess from constant cleaning, they're deteriorating, and they're looking for a more IPAC friendly material that can be more readily cleaned for the safety of residents and staff. Lee Manor is recommending using IPAC minor capital to purchase some ductless air conditioning units to provide enhanced cooling to certain areas of the home. They're also recommending using IPAC minor capital to re-insulate the ductwork on the rooftop of Lee Manor to reduce heat loss or gain through the duct walls. Rockwood Terrace is recommending purchasing assigned slings for each resident to minimize cross-contamination. They're also exploring other opportunities of how else to spend IPAC minor capital. Some of the eligible expenditures for IPAC minor capital and the regular minor capital are more structural in nature and therefore maybe don't make as much sense for Rockwood due to the redevelopment project. And that brings me to the next discussion, which is an opportunity to bring forward for discussion the first floor sprinklers at Rockwood Terrace and potentially funding these with minor capital. So this was included in a report back in June 2018. And at that time, the committee decided not to award an RFP due to the pending redevelopment project for Rockwood Terrace. What is different this time is that there now is funding to support some of the cost of the sprinkler. So I may just see if Karen has any more insight on this project.
Karen?
Thanks, Joanna, and through you, Mr. Chair. As Joanna mentioned, there was a previous report on sprinklers on first floor. I'll maybe back up a little bit. For those of you who weren't on committee or council a few years ago, when we installed sprinklers on the second and third floor of Rockwood, which are the only floors that have resident bedrooms, the thought at that time is that we were going to renovate the first floor fairly significantly. So that's why the first floor was left out of that project originally. A few years later in 2018, we actually went out to RFP to do the sprinklers on the first floor. But with the pending redevelopment at that time, it was council's wish to hold off on that project, understandably. We bring it forward now just for discussion. To see now that there's some money that can be used for this purpose. There is a requirement through the fire marshal that occupancy buildings have sprinklers entirely by January 1st, 2025. Now, I know at the task force meeting last week for redevelopment, the project manager indicated that they expected that project would be completed by 2025. So that's something to keep in mind as well. If that's the case, these wouldn't be required. There's also a possibility that the ministries of health and the fire marshal might look at it because we're into redevelopment. Would they be a little lenient if we weren't, say, compliant by January 1st, 2025, because we were moving to a new building within months? I don't know that if they would be lenient, but we're just trying to present as much information as possible to this committee to look at it and possibly make an informed decision about where we should go. Or maybe the decision is that we hold off another couple of years and see where we're at. It's just right now we have this funding that could be used for that purpose. The other things, there's a very limited list about what this funding can be used for. And we continue to look at other items as we move along, like flooring. We've been holding off on some of these items, as you know, and only replacing them on an emergency basis. And we can continue to look at those opportunities as well. But just wanted to provide this information to have this discussion.
All right, thanks, Karen. And I see Kim's hand up. Kim, part of this decision likely involves what the long-term outlook for the existing building is going to be. And I think we're getting some reports coming back on the potential for that, aren't we?
Yes, we are. So that meeting was just set up for June the 3rd. At this time, I don't believe that the recommendation is that there would be that this building would be a good candidate for renovation, if I can put it that way. I don't think we're continuing on with this building. I think something else will happen with that particular part of the property. The question I was going to ask Karen would maybe to speak to is about your work with the fire department, and where's West Grey Fire in working with you and working with the home.
Karen?
So other than approving our fire plan and their annual inspections, that's basically our work with West Grey Fire at this point. I should also note over the past year, maybe 18 months, we've had one small fire and one issue of smoke on the first floor. I'm not sure that either would have tripped the sprinkler system, and maybe that's a good thing because the sprinkler system can also cause damage. But
Yeah.
the first one was in the kitchen, and those of you who were around last year, there was a report or the report to the ministry on this, but it was some towels that were left on top of the oven that started on fire, or on top of a rationale system, and basically burnt themselves out in the middle of the night before anybody noticed. And just a few weeks ago, we had a belt go on the washing machine in the laundry room, which never resulted in fire, but filled the room with smoke. So the fire department visited that day to determine the cause and to help us clear the smoke out of the building. But that's been the involvement with West Grey over the past few years. They do inspect the building annually, and we have an approved fire plan with them. Yeah.
Joanna, how time sensitive is the decision around sprinklers?
Well, the funding has to be used by March 31st, 2022.
Okay, thank you. Questions from committee members? I think Dwight, I saw your hand. Go ahead.
Thank you, Mr. Chair. I'm just curious. I'm concerned with the older type building as Rockwood. Is a main trunk line that feeds the building sufficient to be able to increase the capacity of the sprinkler system on the first floor?
If I could, Mr. Chair, when the sprinkler system was installed for the second and third floors, it was thought at the time that there would be an extension to include the first floor. So I would have to say yes, it is adequate, because the thought at the time was that there's going to be the first floor added on, as well as a renovation and extension to the first floor even. So they installed that project at the time knowing that.
Other questions from committee members? John, go ahead.
As far as the deadline for retrofits, I don't know of any fire department that would give an extension. They're usually fairly hard line on that, but what they want to do is they want to remove their liability from anything. So what they'll do is if they want to work with you, they'll give you a warning when it's the date of completion supposed to be there for a retrofit, and then come back and give you a certain amount of time to check on it or whatever, which usually would be a few months. So if it's close and we're willing to take on the liability, that they'll sign off and I won't say pretend they're doing their job, but they'll give you a time to do something. But those hard and fast dates by the province, like I say, I don't know of any fire department that would actually put in writing that they'd give an extension. Having said that, the kitchen area is probably already covered by an extinguishing system, I would suspect, at least the cooking areas of it. So if they are, and there's the alarm system's up to date, and there's no residents on the bottom floor, I would have a tendency to kind of play it by ear. I think Tim's input there about whether the building would be used for something else. If the report's coming back in the next few weeks, maybe if we waited until our next meeting And then we'd have kind of all the information and we could see where we go on that. So that's just kind of some more stuff to think about with it.
Thanks, John. I think that makes a lot of sense if we could defer the sprinkler part until we get that report back. It would be nice to have a clear idea of what the future holds for the old building. Warden, go ahead.
Thank you, Mr. Chair. I was going to ask, I haven't heard a price tag on this project. Any sense at all of what that might cost?
But Mr. Chair, we haven't actually had anybody look at it recently, but what we have currently budgeted in capital is almost $127,000.
I guess my feeling, and I know we'll probably discuss this June 3rd, but my feeling is, boy, I would hate to put that kind of money out and then, shortly thereafter demolish the thing. It just seems a real shame. And if it were an absolute, requirement, if people were saying do this or else, I think we'd have no choice. But it seems to me that we've been on the right track so far. We do have a definite plan to be out of that facility. The sooner the better. I would think, gosh, I would hate to spend that kind of money and then, if it is demolished and then demolish the thing, that would be a real shame.
Brian, did you have your hand up? No? Okay. Any other comments? So as far as moving this report, can we vote on the report with the exception of the sprinklers? Where's Heather?
Right here. I'm actually going to recommend that we have an amendment that the following be added to the second clause. And I'll quote that, with the exception of the Rockwood Terrace sprinkler system installation, because I think staff want to get moving on the other projects. So if we could add that in there. And then I'm wondering then, once the long-term care redevelopment task force meets, that staff bring back a report to the next committee of management meeting, which is scheduled for June 29th, related to the sprinkler system. So adding a fourth clause as well, just directing staff to bring that report back to the next committee of management meeting.
That makes sense to me. Is that okay with the mover and seconder?
So we'll just need a mover and a seconder for the amendment.
So moved
Can I have
on the
a mover and
amendment.
seconder for the amendment, please? Moved by Barb and seconded by Christine.
Thank you.
Any discussion? All in favor? That is carried. Thank you.
Then, Mr. Chair, we'll go back to the original motion and it will now be as amended. The original motion was moved by Councillor Robinson and seconded by Councillor Burley. So if they're okay moving and seconding the amended version, then then you can vote on that then.
Yes.
Okay, the mover is fine, and
Yes.
Dwight? Okay. All right, call the question. All in favor of the amended motion? That is carried. Thank you. We now have LTCRCM 1121 regarding the Grey Gables Behavioral Support Transition Unit status update be received for information. Can I have a mover, please? Moved by John and seconded by Brian. Okay, Jennifer, I'll turn it over to you.
Great, thank you, Mr. Chair. I was jumping the gun there. So this is an exciting update. As you know, on March 6th of 2020, we submitted our proposal, a revised proposal recommending Grey Gables as a potential site for a behavioral supports transition unit. On March 24th, 2021, we received confirmation of a 2-year pilot of the proposed 20-bed BSTU at Grey Gables. Our resident-centered philosophy of care, that is our Color It Promise at Grey County Long-Term Care, positions us well to embark on this very important initiative. So just to give you a bit of background, the Southwest LHIN has recognized the need for a BSTU in Grey County, and Grey Gables has been the identified site. During the pandemic, it has become more apparent the need for a BSTU in our community. And in her previous report, Joanna mentioned the alternate level of care individuals that are living in hospital waiting for a long-term care home. And some of those individuals have specialized behavioral care needs that are best suited in a unit like a behavioral support transition unit. So by having access to proper programs and services, hospital beds will be available to those who need them, and people will have access to the care and services that they require. For implementation, the Southwest LHIN team is supporting Grey Gables with the implementation of the unit and working closely with myself and with Shannon, the executive director. And to lead the implementation of the BSTU, part of the proposal included a 12-month contract of a best practice coordinator and implementation coordinator dedicated to the project. This role supports the transition of the traditional home area to the specialized unit, focusing on design, policy recommendations, resources, recruitment, training and education, stakeholder engagement, and partnership. The best practice coordinator will focus on the development of leading evidence-based best practice guidelines for long-term care homes and supporting residents with responsive behaviors. What's really exciting about this project is that it doesn't just give us an opportunity to support 20 individuals with specialized needs, but it gives us an opportunity to design leading practice, leading education for team members supporting residents with responsive behaviors across the long-term care sector. And the opportunity is to share that learning and training with the other 19 long-term care homes in Grey Bruce and even beyond. As we know, many of our residents moving in may not meet the criteria for a specialized unit, but they do have some sort of dementia and at times have responsive behaviors. And this is something that we need to prepare our team members with the tools and the training to support those residents in living their best life in long-term care. We are fortunate to have very skilled individuals within our organization, and Lee Manor's Associate Director of Care, Tolleen Parkin, has accepted the secondment for Best Practice Coordinator position. Kelly Keffer, a registered nurse at Rockwood Terrace, has accepted the secondment for the Associate Director of Care position at Lee Manor. Recruitment will begin shortly for the unit coordinator, which is a permanent position for, well, sorry, it's the 2-year pilot position for the BSTU. And this role will work closely with the best practice coordinator and be responsible for the journey that the resident takes, the admissions, monitoring, evaluating, and supported transition to their long-term care of choice. Regarding physical environment, Grey Gables currently has 3 home areas, and Maple Lane's layout and 22-bed design will be dedicated to the space for the 20-bed BSTU, and it is a separate and secure unit. The structural design will require some minor modifications, and our focus is to ensure that there is minimal disruption to the residents and overall operation of the home. The current Maple Lane residents will begin to transition to the other 2 home areas, Pine and Valley. Every attempt will be made to maintain the same type of accommodation. So private room to private room, basic accommodation to basic accommodation. Before a resident is moved, there will be a conversation with the resident and their family. And during this transition period, current Maple Lane residents will not be sharing a room with a behavioral support transition unit resident. Regarding the finances and human resources, Grey Gables has received some one-time funding to help support the capital changes and the startup costs. And then we'll receive almost 1.3 million in one-time funding in 21-22, as well as in 22 and 23, to fully support the operation of the 20-bed specialized space. The funding is sufficient to fully fund the pilot and will assist with the environmental, security, and outdoor enhancements, equipment and technology, training, and professional development. The BSTU will have dedicated staff, including registered nurses, registered practical nurses, PSWs, recreation aides, as well as that BSTU unit coordinator. Residents will also have access to social work, physiotherapy, spiritual care, dietary services, and other specialized services. And these team members will all receive specialized training to ensure they have the skills and tools to safely support the care of each of the residents. We have begun some engagement and communication about the project. So staff, residents, and families have been notified, and we held a virtual family meeting on April 15th to provide an update and next steps. And the letter that was sent out, provided to residents and families and staff, is linked in this report, as well as the presentation that we shared on that virtual call. We are in development of a Grey Gables BSTU webpage and on the Grey County site, and will include news releases, updates, and FAQs. And there was not a huge response to the virtual family meeting, but there were a dozen or so family members that joined the call and had some really good engaging questions. And I think that that will increase as the project moves along. And so this morning, I also would like to just introduce you to Tolleen, who is with us on our screen. And Tolleen comes to us with a master's degree in healthcare quality, over 15 years experience working in the long-term care sector, and most recently as the Associate Director of Care at Lee Manor. She's very familiar with behavioral support transition units histories and worked on the project in her previous role working with the Southwest LHIN. She prides herself on keeping informed on leading best practices, and her passion for resident-centered care complements our Color It philosophy, and she will definitely be an asset to the BSTU. So welcome, Tolleen. And so I'd like to introduce Tolleen. Did you want to say a couple of words, and then we'll see if there's any questions?
Through you, Mr. Chair. Thanks very much, Jen. I don't have much to say. I'm just getting my feet wet this week. Obviously, just getting started. It is really exciting, I think, to see Grey County support an initiative like the Behavioral Support Transition Unit. It's something that's really needed to help people with dementia and their families that are experiencing the challenges of how to cope with the changes that happen with dementia. So it's really, really exciting that we're moving forward with this. And as Jen alluded to, I really believe that this is not just about these 20 beds, these 20 people. This really is about building capacity across all three of our homes, and as Jen said, across the province. So I'm really, really excited. So thank you.
Well, certainly welcome, and we appreciate Tolleen, you taking the new role, and I know we're all excited about having this regional resource available, for the responsive behaviors and the behavioral supports that are required by so many. So welcome, and we look forward to getting regular updates from you on our behavioral support unit. Questions from the committee? Jen, one question I had, I believe on a previous report, you thought there may be issues in attracting the proper staff for this unit. Has that been worked out?
Through you, Mr. Chair, thank you. I'm not sure that it's attracting staff. I think it's more of just the lack of health human resources across the province, just that there aren't enough people going into the healthcare sector. And I'm not sure the pandemic has improved that. In fact, I'm pretty sure it hasn't. But what I can say is that Shannon has held some preliminary meetings and with the BSO team, the embedded team at Grey Gables, as well as working with the union, our union partners. And there's excitement at the home about this opportunity and being part of something that really supports it doesn't only support the residents, it supports the staff and having the tools they need to do the care that they desire to do, to look after people that may be a little bit more challenging to support. And this opportunity gives them the time to do the learning and hear from experts. And so there's a general excitement. We still are in the early days of the discussions with our union partners to sort out how that goes and how we're supporting transitions. We want to be able to provide opportunities for staff that are already working in Grey County long-term care, particularly Grey Gables, and then more broadly, if they're interested to work in the specialized unit. And then we'll reach out more broadly into the community, looking to recruit, to support any vacancies in the traditional space, as well as any vacancies still in the STU.
Okay, well, that's good to hear. Thank you. And just one other question. Is there any sense of how many residents across Grey and Bruce long-term care facilities would meet the criteria for a BSE unit right now?
I don't know if I have a number. We've had a few meetings with the LHIN talking about the beginning of putting together the wait list or the eligibility list. And so at this point, I can't put a number on it.
Okay.
There are definitely residents that are eligible and waiting. There's a handful of these types of units across the province. And what we have been hearing from our colleagues is that the pandemic and the rules around isolation and admissions and transfers has made it a little bit more challenging to do some of the moving and admissions in the already established units. We're starting more at the tail end of the pandemic, and so I don't think we will face those same challenges. But in terms of quantifying it, I can't, but that is something we can bring to a future meeting.
Thank you. Kim, I see your hand up. You're on mute, Kim.
Apologies. We know that those ALC patients in the hospitals in this area, have continued to, they're waiting for places. And one of the things that may be of help to get them more appropriately placed will be the behavioral support unit. So we know those folks are there. If you talk to the people at GBHS or Collingwood or any of the other hospitals, I think they would, say that that's a situation that people have been trying to work towards resolving for a long time. And so hopefully this is a start to that. Because Jen, where's the closest one? London?
I think London.
I think so. Maybe
Yeah.
Tallene knows.
There's one in Durham region, but that's still fairly far away, and it's not a transition unit, it's a specialized unit. So there's some nuances in the titling.
Right.
All right, any other questions from committee members? Okay, all in favor? That is carried. Thanks very much for that report. We now have LTCRCM 1221 regarding the AMO recommendations. Update be received for information. Can I have a mover? Moved by Warden and seconded by Dwight. Jen, I think you have the floor again.
I'm going to pass this over to Dana, who's going to give this report.
All right, Dana, the floor is yours.
Thank you, Mr. Chair and members of the Committee of Management. At our last meeting, we talked about AMO recommendations and what that would mean for Grey County. And the ask was to come back and have us take a look at that. Well, there's been a lot of development since that time. So today I want to give you a bit of a background, and for those listening, just to give a bit of context and background to what's been happening in long-term care, talk a little bit about some of the reports, how it's impacted us as a municipality, and where do we go from here. So just some high-level background. As you all are aware, the COVID pandemic has had a significant and disproportionate impact on residents in long-term care, with a larger proportion of the current deaths attributed to those who reside in long-term care. The Commission identified in their interim and mid-report, and since this submission, we've received the final report from the Commissioner, but the Commissioner identified insufficient leadership capacity, lack of leadership presence, increased vulnerability of residents, struggles with sufficient PPE, and limited staffing resources as some of the contributing factors. As Jen alluded to earlier, this was exacerbated by the Ministry of Long-Term Care identifying that staff could not work in more than one healthcare setting. We also know factors contributing to the death of our long-term care residents in the province were related to increased community spread and lack of strong infection prevention and control measures, and the challenges resulting to control the virus, further exacerbated by some of the structures of the long-term care homes with 3 and 4 bed units. So as a result, we know that the Long-Term Care Commission identified a report with the Honorable Justice Frank Morocco providing 85 recommendations, and that was sent out to all of us April 30th. And many of you might know Justice Minister Frank Morocco because he participated in the Walkerton inquiry for us here. So there was also a report from your association, the Association of Municipalities of Ontario, where they created the Health Task Force. And that final submission came in January 2021, where it outlined 49 recommendations to help address the successive wave. And that was before we're experiencing the current wave we're going through. But it was also helped to prevent any similar and further infectious disease outbreaks. And probably less expected, but also received in last month was from the Auditor General. I don't think many of us were anticipating that, but the Auditor General submitted her recommendations as well, 16 recommendations to help better respond to the issues emphasized during the pandemic. So with those 3 reports, although we haven't had the ability to go through that in a very fulsome way, we anticipate to do so next month for the report. But I thought it was important at this time, with that provincial context and in reflection of the 3 reports, to see how we fared in the Grey County municipal homes. I'm pleased to report, as you're well aware, that Grey County, we were very fortunate that we did not experience the devastating outcomes of those around the province. We had no resident deaths attributed to COVID-19. We had one of our homes in COVID outbreak confirmed, but that was due to 1 staff member and was isolated to 1 unit. In the present outbreak definition, it wouldn't actually classify as an outbreak, but with our support of the staff and our public health partners, that was contained. And so reflecting on the LTC Commission's interim report and those other reports, there are a number of supporting factors that I want to present to the committee today that we had in place prior to the pandemic, which protected our residents, families and staff, as well as a number of other strategies we implemented throughout the pandemic to navigate and mitigate the potential negative outcomes. So in terms of what recommendations we would suggest going forward, we just want the committee to have this context. So in terms of leadership, when the commission identified that there was a lack of leadership, that wasn't the case in Grey County. Leadership was present in the homes each and every day to provide direction and support. There were leadership teams identified and divided themselves into 2 groups. So we ensured a rotational 7-day a week support for all of our staff. And this continues today and actually has been enhanced as we have increased our support of the senior management team and other staffing positions. Personal protective equipment was not a challenge. I recognize we were looking and searching it out, but one of the things that Grey County Homes did was implement universal masking before the province identified that. And actually, Jen Cornell called all long-term care homes to the table, including public health, on March the 13th, where we all committed to doing early masking long before the province had identified that. In addition, as it was identified, we had eye protection. Yes, the Ministry of Labor identified that, but that was long before we had our provincial direction, and we already had that in place to start implementing, but that also provided some supportive PPE. Our staffing resources, with the support of the Grey County In It Together, Color It approach, all jumped in, and many staff were redeployed, and the ability to have that redeployment of staff that weren't being utilized, as well as implementing very quick rapid training, also put us in a better spot to support our residents and families and staff. Staff schedules were adjusted to enhance and support some of those things that in terms of staffing resources when the one location was implemented. In addition, obviously there's things we're taking a look at with Rockwood, the new build, but the structure of our facilities where none of the homes in the Grey County, that the County of Grey manages at this point had 3 to 4 bed wards. All of our homes have to the maximum 2-bed units. So that also afforded some supportive measures with reducing the spread of any potential virus. I'm really pleased to hear and to share with you about our IPAC measures, where we actively engaged early on both our public health and hospital partners to do a thorough IPAC assessment. Those continue today monthly, and we act and implement it. And we were very keen to get some dedicated IPAC staff. Now, this is an area where I think we could obviously support, and that it's if we can strengthen our IPAC education and training and dedicated staff, I think we'll continue to go, but we have some beginning stages with that. I also am really pleased that our leadership staff and all frontline staff, to a point of almost 100%, if not more, completed all 6 IPAC Public Health Ontario modules so that we all had a foundation of IPAC prevention. We reviewed with the province our IPAC cohorting to ensure, even though we had 2-bed units, what could we do to maximize our ability to cohort as well as reduce any potential spread. And we've shared today about our increased surveillance and early detection measures with PCR testing and rapid surveillance. But one of the things that really, I think, in the end, it's all of those strategies, but communication and partnerships. And I think we did that very well in Grey County, not only with our Grey County operated homes, but in Grey and Bruce in general. We did some sort of the partnering with our weekly sessions. We also, through Jen, the Director of Long-Term Care, weekly meetings with long-term care home and community, long-term care home and community partner meetings were done. We also had the Color It Connect that was already described with the MailChimp, the virtual town halls, keeping our families and stakeholders informed. And again, the ability to activate DCPs who became great partners within our homes, supporting our residents emotionally and socially. And I can't speak enough about that program, not only the way that it was implemented in Grey County, but how the tools and resources were shared with people in Grey and Bruce, as well as provincial and beyond. And as we talked about the COVID vaccinations, and we do have a plan and are continuing to manage the sustainability of that as we want to support and reduce any concerns for those who have vaccine concerns, but we are going to continue to manage that, as well as to figure out as new staff come in and flag how we can ensure that they are vaccinated and reduce barriers. For many, that could be transportation to a hub. So how do we support those going forward? How do we support our DCPs and staff? So we're going to maintain that vaccine status. And I think our numbers are really contributing to recognizing the changes that can help for residents. And I do believe staff see that what they can contribute also supports residents having more activity and movement around their home and community. So, and again, I can't just to again reiterate partnerships. The ability to talk to each other through Zoom has been a silver lining because we've maintained communication locally, regionally, provincially, and nationally through those partnerships. And that has strengthened the collective voice of long-term care and mutual solution and working together. And in summary, we've done very well. We recognize that there are things through the Long-Term Care Commission, through the AMO recommendation, through our Auditor General that we can do to improve. We can't speak again enough about the support of the Long-Term Care Committee of Management and how we've been able to align and share these resources, and you've supported us doing some unique and innovative strategies. There are a number of AMO recommendations that would further enhance that for our residents and our ability to color it for them tomorrow. And we will bring that additional report in June as we assimilate all of this information and share with you what we're presently doing and reflecting on all that, what we can do and add additional precautions to our current practices to cover it for our residents going forward.
Thank you very much, Dina, for that report. That was certainly a feel-good report when I read it. Questions, comments from committee members? Seeing nothing, again, to all the leadership team, all the staff and other departments, it was highlighted in this report. Everybody pitched in, and I think, you know, Grey County was leaders in, you know, best practices, and going forward, I think a lot of, you know, other areas are going to pick up on that. The commission report, you know, I know people are still working their way through that, but in light of some of the situations that occurred across the province, we were so fortunate to have, you know, the people involved with our seniors that we did. And, you know, I sharing that information with the other long-term care facilities through Gray and Bruce, I think made a world of difference. So thank you very much. All in favor of receiving this report? That is carried. Okay, our next meeting date is scheduled for June 29th. Can I have a mover to adjourn, please? Moved by Barb and seconded by Brian. All in favor? That is carried. Thanks very much, everyone. Have a good day. Take care.
Thanks so much. Take care. Bye.